Well, we're here today at the AmChip conference. It's Tuesday, our last day of the conference, with a couple special guests. So I'm really pleased to introduce two friends of AmChip, the AmChip president, Stephanie Birch from Alaska, and Aimee Eden, who's our Reality Works and Go Beyond MCH scholarship winner this year. And we're just so pleased to have the chance to visit, to see you guys this morning. Thanks for taking some time out. And we're also really pleased to both Go Beyond and Reality Works for their support of both the conference but also the scholarship. So it's great to have the chance to visit and talk a little bit about MCH today and MCH of the future. So let's just get right into it. I mean, we were just at a session this morning on chronic disease and maternal and child health, and I just got to thinking, you know, this is where we need to be. It's about, you know, bringing together and integrating across state programs. We've got so many different resources to leverage, and you know, we could just sit back and say, you know, that's nice, but I'm just going to do my block grant, you know. But you know, for MCH leadership moving forward, it feels like that's not good enough. You know, what do you guys think about
Well,
that?
I would agree. You know, one of my presidential goals was really around advocating for and making sure that we're doing a good job of getting our young adults and young professionals ready to take over. If you look at the MCH family, there's probably more of us on the end of retirement soon than those that are sort of coming in.
Right.
And we're very fortunate to have, 6 public health programs that have MCH as one of the core programs of what they offer. And so I'm really excited that AmChip in particular is really sort of binding that together and finding opportunities like our scholarship program, supporting that, and we really appreciate the support that our sponsors have provided for us to happen, to really kind of make that happen and allow folks like Aimee to come and feel like they have a part really to play at the MChip conference. The MCH Bureau has put together the MCH competencies, which I think really provide a nice framework. It helps, I think, young professionals who are coming into the profession to sort of see, okay, these are the things that we need to achieve. And I think states have really adopted to that, and some states like Oregon have created job descriptions around those competencies. And I think it provides a sort of natural development process then for our new young professionals to come into MCH. And I think we've done that better than most other sectors of public health. So we hope that you know, MCH is going to be the place where people choose to come and work.
So do you feel like you're being trained well to work in this environment where you integrate programs and coordinate different kinds of activities, or what kind of stuff's going on there?
Yeah, for me it's about integrating research with what's going on in practice and moving that forward. And I love some of I do think MCH is sort of cutting edge in public health with bringing in families. I absolutely love, I sort of got into leadership accidentally by being asked to be a parent representative on a Covering Kids and Families coalition in my state. And so I really feel that you know, incorporating families, that is just huge, and that is cutting edge. It's not being done in other places in public health.
Yeah.
And I think listening to Dr. Lou and Dr. Christopher talk and give their own personal stories to us is also something that MCH kind of, you know, it's an emotional connection to our work and to each other as professionals and the people who we hope to eventually work for and service. And I do feel like, you know, at the research side, in combination with the practice side, though, I also love how it's interdisciplinary. I'm really an anthropologist by training first, as well as public health. The ability to incorporate both of those together and think through things. I think the MCH competencies are actually brilliant, and I love the self-reflection piece of it.
Right.
That's, I think, again, being a family, you know, being sort of a parent representative or a consumer, bringing that perspective to things. I feel like the self-reflection part allows MCH professionals to think about how they fit in as well, instead of just I'm the professional, I'm the expert, and I'm going to provide a service, or I'm going to you know, do this research.
So when you're looking at resumes, you know, people wanting to apply for jobs and be part of your program at the state, you know, what are you looking for in a new MCH worker?
Good question.
Yeah, that is a good question. You know, I really look for someone who's going to have had some broad experience. And I'm not unwilling to sort of take people who sort of place themselves through school, you know, bachelor's to master's program, but I'm looking for folks who have really sort of applied themselves in a variety of different ways. We're fortunate enough that our classification system allows a wide variety of folks to apply for some of the positions, and I think that really has enriched our staff as a result of that. You know, I try not to go with too many nurses or too many epidemiologists. I'm sort of looking for a broad perspective.
So do you think you'd hire an anthropologist?
Yeah, you know, absolutely. I think, you know, anthropology is really kind of an up-and-coming recognized field with a lot of purpose, I think, in public health. And I think that's going to be a really nice sort of feature to add to it. I'm so impressed by the training programs that have done the research piece. And in our state in particular, I've really tried to build our MCH epidemiology unit to be very robust, and we're very fortunate to have 5 very well-trained statisticians and epidemiologists in that section and they're all assigned to programs, and they integrate the work in with the program. So they kind of bring the evaluation and data expertise, and I think that that's really enriched the more program side people and help them sort of appreciate the disciplines, and has built up the skills of both, which I think is really important. In the past, sometimes I think we had sort of, you know, this is my work and this is your work, and we don't really sort of get together. You know, somewhere in the middle it gets blended. And I think the training programs and the internships that people can take advantage of through CDC and the Bureau really help them to sort of see, you know, we're all public health, and these are the skill sets that we need around this particular time. So we're always applying for, you know, having interns come up to Alaska to spend time with us, and that I think really enriches our experience too. They bring things to us and help us look at the world a little differently.
What kind of a workplace do you think that MCH graduates are looking for these days? Not just from the applicant side, but the potential, you know, what kind of environment do you think folks want to be in to really do this work?
Yeah.
It sounds like grounded in families and grounded in consumers. And
Yeah, you know, having a family myself, having children, and, you know, it's sometimes interesting. You know, we are the advocates, and I'm in a maternal child health program in a community and family health department at my university, and yet there's not always the support for students or faculty who are parents. So I think we need to talk the talk, and we need to walk the walk a little bit better, and, you know, be models in our workplaces. And so for me, looking for a workplace, whether it's in a university or a state health department or anywhere, I really would look for. And when I was looking for a university, as a matter of fact, my daughter was 1 at the time, and it was a big deal that the departments that I was applying to had seemed family friendly, at least to some extent, and seemed supportive of that.
So they're probably training you well in research and, you know, study design and probably some writing. What about advocacy? Do you feel like you're being trained to be an MCH advocate as well, or is that a place where there may be some room for new material? Because I just feel like we've lost that component. I feel like I was formally trained in statistics as a sociologist to go teach sociology, and I had no idea what an advocate did or was, but I knew I was missing something. And then when I got into MCH and I started realizing what it was really all about, and in fact there's not a lot new about being an MCH advocate. It's kind of going back to the future. You know, Dr. Liu talked about 100 years of the Children's Bureau, where those women were advocates for kids, for families, for improving social conditions, and we've kind of lost that. It's become this medicalized, you know, clinical. I feel like we need to get back, like a core course in policy, how government works, why appropriations work the way they do, you know, what it really means to do a Hill visit and get to Congress, and how this legislative process works, and what's really driving all that. I'd take that class.
I did not have that class, and I totally agree, because I've been kind of flailing around a little bit, trying to, because I see myself as an advocate, and back to, you know, my leadership falling into that actually was more of an advocacy role. Advocating for different kinds of services for families and parents. And so I started learning by practice, but not through my academic program.
Right.
And then I attended the advocacy webinar that AMCHIP had a couple weeks ago, which was amazing, and I learned so much. I would have never thought that, about targeting it, even like what really is the Appropriations Committee and who sits on it and what does that mean versus, my other representatives who serve on different types of committees.
Great.
So, yes.
Yeah.
Yes.
Good. Well, I just think it's an important thing for us to think about. And I've worked with a lot of schools of public health and their MCH programs and a lot of faculty to sort of think that through. And, whenever I go out and do a visit, that's a really popular topic that students want to learn a lot about.
Yeah, and you always have those people who say, I'm not political, I don't want to be
Right.
involved in politics, but I think we need to make it clear that it's a huge, important piece of, if you want to continue working in MCH or public health,
Right.
you can't avoid that.
Right. I mean, that's why it's a key
Yeah.
MCH competency,
Yeah.
a key MCH leadership
Yeah.
competency.
Yeah.
And I do think it's also important, there's nuances, like there's things you can and can't do working in state government. There's opportunities, there's barriers,
Right.
in terms of legislative activity, but just to know the process and have the chance to, that's something I think
knowing
we
the
should work
difference,
on.
as I say to my staff, maybe we can't advocate, but we can educate.
Right.
And that's where it's really terrific to be able to sort of go with those different teams of staff, for them to really, with great pride, talk about, this is how we're using the money in our state. This is how many women and children and kids with special health care needs that we've served as a result of you supporting this funding. Or even if they didn't support the funding, they need to know that, we did use the money wisely. And I think our federal representatives oftentimes don't know that. And because they can't sort of see it in their state, it's hard for them to kind of get behind these issues. So I'd like to think that even when states are limited to education, it's a nice blend, and sort of provides a platform then for the advocates to come in and say, this is why this is really important.
Yeah, and you actually set that up perfectly for me. I made a Hill visit yesterday, and I'm not affiliated with a state, and I could say what I want, and
Right.
but the tools, the talking points and the state profiles, so I could talk intelligently. But I also had a personal experience that I could relate. So kind of all in way, I had the tools to make.
And you were well received?
I was very well received.
Good. You got a commitment from your...
Well, I'm not sure about a commitment, but it was a legislative assistant who
Oh, well,
I
that's
talked
good.
to. But,
Yeah. They're the ones actually oftentimes writing the bills, so
Yeah.
they're the ones you have to
Good.
convince, I think, sometimes.
yeah, and she was also pleased that I wasn't allowed. Yes, she said it was refreshing.
In this town, it's really refreshing.
Yeah, absolutely.
Well, I think there's a lot we could talk about and a lot to cover, but it's just great to have the chance to visit with a new leader, a seasoned leader, and kind of think about the future workforce and workplace and some of the opportunities that we have at AMCHIP to support the work that you do and to bring up great MCH leaders. So it's really wonderful to have the chance to visit with you, and I want to thank Go Beyond for being such a good sponsor of AMCHIP and working with us on this project.